but since I'm trained in emergency response, I'm also qualified to do that assessment. So my assessment looks like two different things. We do a memory component. So how well can you remember things? Initially, we'll just ask you simple questions like, hey, what day is today? What quarter is it in the game? What is the score? What play just happened? Who has the ball? Who has possession of the ball? Just to kind of see their orientation. Do they know what's going on right now? If that works, and then and all the tests are kind of progressive. You start easy. If they don't pass that easy test, they're out of there. You're not going back in the game. If they pass easy, we get harder and harder and harder and harder just to see how their body and how their brain is functioning. So if they pass that, then I ask them 5 questions to remember. So now we're testing their short-term memory. Because in the area of your brain, short-term memory and long-term memory are in 2 different positions. They're 2 different spots. I can remember my 3rd grade teacher, but I might not remember somebody's name that I just met 5 minutes ago, okay? Because they're in 2 different areas of the brain. So then we test their short-term memory. Now for me, I have 5 words that I always use. I always use the same 5 words. Because when I first started, I would come up with words and then I wouldn't remember the words myself. So pro tip, use the same 5 words. So I ask them those 5 words, they repeat it back to me, okay? Make sure they got it. I might do this 2 or 3 times, so I make sure they got it. And then I'm gonna distract them. I'm gonna test something else. I'm gonna look at their balance as well. So their balance has to be really good. For an athlete, your balance is key. If your balance is off, then you're way more likely to get injured, okay? So now this is a future risk for injury. So I'll do some balance testing, and then I'll come back and I'll ask them those 5 words. If they don't get all 5 of those words, they're out of there.